Good to be back, and yeah, it was a difficult mission, and many of you will have heard Dr. Tedros speak about his own personal reflections in terms of his own experience of war and the memories that brought back. I've been in so many different conflict situations and so many different epidemics that sometimes you become, I wouldn't say immune, but it becomes part of your job. And then we've been, in a sense, closed here in Geneva for a year or two and unable to travel very much. And then you go back, and within a few hours of Geneva, you're in a situation where you're meeting women and kids in hospitals in Poland who've been in Mariupol, in basements, kids asking their mums whether the thunder is going to stop soon and whether they can go home. I think one of the kids we met thought we were coming to take her home. So you see those personal stories, and you know, it's one thing to see the statistics, it's another thing to see the images on TV, but as Tedros reflected on, it's the sights and it's the sounds and it's the smells of war, and many of us have that experience. And it's just, it's harrowing to see it, but it's also inspiring to see how the health workers of Ukraine have responded. Despite so many attacks on healthcare facilities, despite the extra demands of refugees in the surrounding countries, how the health communities in the surrounding countries have rallied. I was asking some of the doctors and nurses in Poland, so are you doing extra hours? Say, yeah. Are you doing extra shifts? Yeah. Do you have enough staff? No. How do you feel about all this? And they said, fantastic, this is what we should be here for. They're not looking for extra resources, they're not looking for anything extra. And then you see how the displaced people in Ukraine, and there's over 7 million people displaced inside Ukraine, and many of them are families and very often have more vulnerable people with them, so they can't get to the border. So older people, people with mental health conditions, with disabilities, pregnant women and others. And they've been taken in all over Ukraine as well, and there's extra strain on the health systems in those parts of the country. And then you have the people living in the front lines, and we visited a number of different suburban towns around Kiev that have been the subject of real intense fighting, and you can see the impact on one beautiful streets that maybe 10, 12, 14 weeks ago were coffee shops and pharmacies, and just completely gone. And yet you see that resilience of the workers. We spoke to ambulance workers, and we could see that the ambulances were just riddled with bullet holes, and they were so proud and so happy, and they plastic sort of sheeting, you know, kind of over where the bullets had gone through, and they were still out there doing their work. So it's both a reflection on just how awful it's been for the people, but just how resilient the health system has been, and more importantly, the health workers. And it really convinces me more and more that the health system is not the buildings. The health system is not the strategic plan. The health system is the people who work within it, and their passion and compassion for their own communities. And we have to continue to support those health workers. And it doesn't matter what conflict you're in. Health workers make a huge difference. You know that Dr. Tedros's team for the World Health Assembly in a couple of weeks' time is going to be Health for Peace and Peace for Health. And you can really see how health and healthcare delivery is the foundation of stability, it's the foundation of peace. So we also, a big shout out to our country team there, Jarno Habic and his team. So many of our staff have lost so much. I mean, we had a meal one evening with staff members, and staff members had lost houses, they had lost everything. One staff member from Mariupol had lost everything and was still working to support clinical care in different parts of the country. So our staff have been equally resilient in support of the Ministry of Health and the people of Ukraine, and we're really, I think, bursting with pride for their commitment and their solidarity with the people of Ukraine. We have a wonderful supply system now, and we visited our warehouses. We handed over ambulances to all-terrain ambulances that can operate in very difficult conditions to the ministry. We have specialist medical supplies, but now have rehabilitation equipment coming in now as well, not just surgical equipment, so equipment that will be used for rehabilitating people with traumatic wounds, amputations and other things. Big focus at the moment on mental health, a lot of evacuations of people with serious mental health conditions, a lot of focus even already on recovery and how we're going to be able to rebuild the system. Can we build that system back better? We're talking about building back better after COVID. There's going to be a huge challenge. So we have to both continue to respond to this ongoing health crisis and at the same time think how we're going to help rebuild that system. And in the middle of all of that, we have COVID, and it's not gone away in the world, and it's not gone away in Ukraine. And again, we see it's very hard to know exactly what's happening in Ukraine on COVID because testing has dropped. But people are still being admitted to hospital. There are still issues with oxygen supply. But again, we've provided, we've a lot of oxygen supply plants or PSA plants that are being constructed or coming online. We've provided a lot of very, very powerful generators to hospitals to keep them running off the grid. So we're trying to shore up the system so we can make sure that the doctors and nurses running intensive care units and have access to the power, the electricity, to the oxygen that they need to continue to treat patients. I think lastly, one of the things we're doing, and again thanks to the European Union countries surrounding, is managing and sort of being a sort of control tower for a lot of complicated medical cases, surgical cases who need to be who need to go to other countries for continued care. So we're trying to do the medical triage in the field, connect with the medical services in Ukraine, and then connect those individuals with the European services and move those people. And moving an individual with big needs medically is very different to moving a normal refugee. These people can't walk down the road, they can't run across the border. They need to be cared for all the way from when they're assessed right through to when they reach a hospital in Europe that could be 2,000-3,000 kilometres away. So again, we're assisting with managing that process. So WHO is really engaged in every aspect of healthcare delivery, the crisis response, planning for recovery. We have a fantastic team of people, brilliant partners, 86 organisational partners in the health cluster. The health cluster is the way we organise health specialist agencies in a crisis. So WHO very often acts as a coordinator amongst the international community. We have over 40 emergency medical teams in country. In fact, I met yesterday with the strategic advisory group for our EMTs here in Geneva, and the energy they have to continue their work in Ukraine and around the world is incredible. Sorry, I'm probably going on with this answer, but it's, I think it's important that when we think about global threats and we think about everything in the world that's happening, you have to focus in on those individual people, individual villages, individual families who've been displaced, disrupted, have had their lives destroyed, and what we can do to support them. And it doesn't matter where people are in the world, that's our job. It's increasingly hard to do in a very fragmented world. Very hard to solve the problems we're expected to solve. I think we have 53 graded emergencies in our system, emergencies that require a response by WHO right now around the world. And that's not COVID, that's other stuff. So the world is becoming a very fragmented place. And on the one hand, that fills me with a sense of pessimism, but on the other hand, I see the innovation and I see the passion and I see the humanitarian spirit being showed at all levels. In some sense, we're in a battle for this planet. Those who would destroy it, those who would destroy our peace, those who would destroy our rights, and those of us who want to build peace and build prosperity and build tolerance and build a society and a planet that we can all inhabit with respect to others. And I think we really are in that existential sort of situation right now, and I think Ukraine illustrates that more than any other place on the planet.
For bringing us closer to the field and what our colleagues are doing, and health workers, and also resilience of communities, and it's definitely different when you see it firsthand and seeing on TV, and also having experiences brings different memories or triggers different memories for people. Yeah. Maria, you've been on the other side of the world, and your mission is connected to the COVID-19 response, I believe. So maybe you can tell us what was your mission about?
So my mission was a bit different. I spent several days in Brazil last week, and I was there working with our incredible country office and the WHO representative, Dr. Socorro Gross Galeano. And they organized a mission for me to really see what Brazil has done and how our regional office of PAHO, Pan American Health Organization, and our WHO country office staff have been supporting the people of Brazil in COVID-19, what they've done, and how they are adapting to the current situation, and how they're going to use the systems that have been built to get through COVID, but also for the future. I spent some time in Brasilia, where they organized a meeting of all 27 labs across the entire country, from all states of Brazil, from border areas, where they demonstrated how they've expanded their surveillance capacities for COVID-19, their sequencing capacities, which was beneficial to be able to track this virus, to detect the variants. And if you remember, Brazil had a very substantial gamma wave. Gamma was one of the variants of concern that was first identified. This is the P1 variant. It was first identified in Brazil. So they demonstrated how they've expanded their surveillance systems, their testing systems, their sequencing capacities all over the country, and how that is going to be maintained and sustained into the future. It was very motivational. It was very informative. It was quite invigorating to see that, and I was really honored that they pulled that together. I also spent some time in Rio. I gave a presentation at the Brazilian Academy of Sciences, which was actually the main reason why I went there. And presented WHO's vision of how we're going to end the emergency, how we're going to end this emergency everywhere on the planet of COVID-19. And spent the day at Field Cruise, visiting labs, visiting hospitals, seeing the technical work of that organization, which is more than 100 years old, use science and technology and tools to combat COVID-19 as well as other infectious threats within Brazil and internationally. And lastly, I visited Brasilia, where in the Amazonas state, where if you remember in that gamma wave, they had a tremendous number of cases and deaths. And everyone that we met there was impacted by this virus. Everyone that we met had lost a family member, had lost a husband or a wife or a mother or a father or a sister or a brother. And it was quite emotional. We went to hospitals. We went to post-COVID rehab centers. In fact, I visited 3 post-COVID-19 condition rehab centers in Rio and in Manaus. And just talked to doctors and nurses and lab technicians, patients and survivors. It was really quite inspirational for me to see that. And when I left Manaus, it was important for me to go there to see firsthand how the Amazonas state had dealt with their terrible experience with COVID-19. I told them that, everyone was talking about legacy. What are we doing for COVID-19 and leaving a legacy behind? And there's all this discussion about systems in place for surveillance systems and structures, new hospitals that didn't exist before, new labs that didn't exist before. And not only are they leaving the people that we met, they're leaving a legacy of systems and structure. They're really leaving a legacy of a spirit and a resilience. Just as Mike talked about of the health workers in Ukraine, we're seeing that resilience in health workers all over the world, and I saw that firsthand in Brazil. And that was really moving to me. I met a survivor who lost his wife after 43 years of marriage, and he was explaining how, he thought his life was over. But with one of these community centers, these post-COVID-19 community centers, it was called Respirar, and it means to breathe. And he said that community center brought him back to life. And he goes there every day. So there was, the people of Manaus, the people that have gone through such terrible times, I think inspired the world. And I reflected on the fact, I'm not sure, Alex, if you saw an image, there was an image that sticks with me today, where there's a patient in a ICU bed, and health workers in Brazil, they filled up a medical glove with warm water, warm saline, and they put it in the hand of a patient who is not awake, but to replicate holding someone's hand because their loved ones couldn't be with them. So there's all of these types of moving stories around the world, and I think for me it was really important to get out of Geneva, to talk to our teams, who I was also so impressed with, our teams from PAHO and from the country office doing really incredible work. So it was a really excellent visit to see that firsthand. And I think the challenge for all of us is how do we maintain these systems that have been enhanced for COVID-19? How do we keep it up for this particular pathogen so that we can end this emergency everywhere? And then how do we use the situation that we've gone through in the last couple of years for COVID to end the emergency everywhere, but build better for the future? So there's a lot of discussion around that. So quite a different visit than what Mike and Dr. Tedros had. But that resilience, that spirit, that inspiration, I think was present there as well. So it was really a wonderful visit, and I thank our teams in PAHO and in the country office for organizing that. If you want more info, the teams made a couple of videos for me, and they're on my Twitter feed. So it was just an amazing capture of so many different visits.
Thank you, Maria. And I'm glad you also had this opportunity to finally meet some of the experts and colleagues on the ground. As Mike mentioned, we were all stuck here in a way because of the pandemic. And you both mentioned resilience of health workers and different ideas or ways how they are responding to different crises. And tomorrow is Nurses Day, International Day of Nurses. And one of our viewers said that it is still Nurses Week. So somewhere in the world is celebrated as Nurses Week. So I think this is also a great moment to pay the tribute again to all those brave health workers around the world who are supporting and helping us when we need them the most, with long hours, long shift, double shifts, and also Barbara, who is watching us, has mentioned those also who lost their lives serving us. So maybe this...
We need to be thanking our frontline workers, our health workers, our nurses every single day. They are the heroes of this and continue to be. And I think, we've heard some stories where health workers are not being respected. We've perhaps forgotten the sacrifices that they have all made. So I think every day needs to be Nurses Day. Every day needs to be to pay tribute to our frontline workers. And so if you have an opportunity, those of you who are watching, thank somebody today. And try to remember to do that more often. I don't think we don't thank them enough.
We have received the question, is COVID still circulating around? So yes, it is, but I think maybe this is a moment, Maria, for your regular epidemiological update. Sure. And do we have hotspots still somewhere in the world?
So we do, yes. This virus is circulating, and it is still circulating at an intense level. It's not in the news as much as it has been previously, because there are so many conflicts and challenges out there that are filling up the news. And of course, we need to make sure we pay attention to that. But we also can't take our eye off the ball of this virus. And professionals like us and professionals all over the world are keeping a close eye on this. So we are seeing circulation. Last week, we had about 3.5 million cases reported in the last 7 days, and over 12,000 deaths. That's still far too high a number, given that we have tools that can save people's lives. So while we do see a general decline in cases and deaths, with cases, we are not as confident in terms of our understanding of the circulation because there's been a significant drop in testing and significant changes in testing policies around the world. But still, with 3.5 million reported cases, that's quite a high volume of just reported, and we know that's an underestimate. We see increases in cases being reported across the Americas, across Africa, in the Western Pacific. So that's 3 regions. And in fact, when we last looked, I think as of a few hours ago, cases were increasing, I think, in more than 70 countries right now. That's quite a lot. So in all WHO regions. But in particular, the highest increase we saw was in the Americas and in Africa. With regards to deaths, we saw an increase in deaths in Africa, in the Americas as well. So it isn't over. And what we are worried about with such intense circulation, we are very worried about future emergence of variants. the virus continues to evolve. The more the virus circulates, the more opportunities it has to change. Omicron, which is the latest variant of concern, has many, many sublineages that we are tracking. We'll talk a little bit more about them later, I think, but many sublineages. So the virus continues to evolve, and each new variant is more transmissible than the last. The big question is, what will the next variant be in terms of severity and in terms of immune evasion, which will impact the effectiveness of our vaccines. So it is still happening. It's still out there. And so we need everybody out there to still continue to take measures to keep themselves safe, which is why vaccination is so important, but not just vaccines. I will say it again, it's vaccines and not vaccines only. So, if you are in an area where there is intense circulation, be careful. Keep your distance, wear your mask, keep your hands clean, open the windows, get vaccinated, stay home if unwell. We do need to continue to be vigilant so that we can end this pandemic everywhere.
Thank you, Maria. Mike, we have a question from Dan K.D. Umar, who is asking, what are the key symptoms of COVID-19? And I believe as well, with this lack of testing, with many people being vaccinated, experiencing milder symptoms, that people are maybe not aware that COVID is still so much around. So maybe it's worth reminding viewers on what are the symptoms to pay attention for and get tested when needed.
That's the challenge we face right now, because the symptoms are very non-specific. For any upper or lower respiratory tract virus, generally people may feel no symptoms, or have very mild symptoms, or have very severe symptoms. And those symptoms can range anything from many people just report just feeling off, feeling fatigued, get a fever, have soreness, muscle pain, soreness, stiffness, sore throat, sniffles, runny nose, dry cough very often, or a productive cough. So there's such a range of symptoms that people can have. Even in some cases, people can have diarrhea, or they can have symptoms that don't seem related to what people understand as COVID. So it is still very important, especially if you're a contact of a known case, that if you get sick, get tested to make sure that you don't have COVID and pass it on to somebody else. But there are so many other viruses out there that can cause similar symptoms. So it is harder and harder to distinguish, and especially in places that have got relatively low incidence of COVID right now. There are many other respiratory pathogens around. We see that here in Geneva. We see even here in the office. But it's always good not to pass on any respiratory virus to others. So good hand hygiene and keeping a physical distance, staying home from work if you can, if you're sick, all of those things still apply. The one thing, and Maria outlined that we are worried about, is that testing has dropped off. And for someone who's fully vaccinated, who doesn't have any underlying conditions, you can understand why people might not go and get tested anymore. Number one, testing isn't always easily available. In many countries, you have to pay to get tested now. There's a lot of barriers. There have been barriers since the very beginning in many developing countries to get tested. Financial barriers, distance barriers. People would have to travel for hours to get tested. So these barriers to testing have been there, but they're even greater now. And the difficulty with that for us is that we find it harder and harder to truly track the virus in terms of its trajectory and in terms of its intensity. And that's a big problem for us. But the symptoms are, as I said, quite non-specific. Many people have had COVID will say it was like having the last time I had flu or the last time I had an upper respiratory tract infection. But for some people, it's a very, very serious infection, and they can deteriorate very rapidly. And particularly for people with underlying conditions, they can be relatively okay, sort of sick, and then breathing difficulties can develop very rapidly. And then people need to be able to get to hospital. They need to get the intensive care and the supportive care that they need. And increasingly, with the availability of antivirals, those people who do develop a severe infection and within 5 days of the onset can access antivirals, these can be life-saving. The problem we have is these aren't available all over the world. And again, the same inequity we saw with vaccines is now beginning to reproduce itself with antivirals. That people in developing countries particularly, or even within wealthy countries who don't have access to health services, who would benefit from an antiviral because they have an underlying condition, they're a high risk for developing severe respiratory or other symptoms, that they're not getting access to these antivirals is really a tragedy, and a growing tragedy at this time. So we are concerned that the lack of testing leads to blindness in our system. The lack of availability of antivirals around the world creates another inequity. And then within that, the number of individuals, and it's quite stunning when you look at, even within wealthy countries, the proportions of people who are not vaccinated. And I was looking at some numbers in terms of people over 60 and who are not vaccinated in different parts of the world. And when you look at that, it's quite stunning, because in most, if you look at Europe, yeah, only 14% of people over 60 are not vaccinated. But that goes up and up until you get to Africa. 74% of people over 60 are not vaccinated. If you look at, even in the Americas, 28% of people over 60 have not had a full course of vaccination. In the Eastern Mediterranean region, 22%. So we have left significant numbers of people all over the world, not just in the south, but in the north, who are not vaccinated against this disease. And we know, we've learned this together, unfortunately. The brutal lessons of COVID have been, if you're over 60 or you have underlying conditions and you're exposed to the COVID virus, you are likely to have a difficult course. What we've seen is that having a full course of COVID vaccines, while it may not fully protect you against being infected, it provides excellent protection against being hospitalized, being admitted to an intensive care unit, or dying. And to think that we're so far into the pandemic with the tools we have available that we're still failing to get the most important groups vaccinated, north and south, is truly a tragedy. When we look at vaccination, only 54 countries have reached that 70% target that we set. 72 countries are somewhere in between 40 and 70. They're on a pathway towards 70. That's good. But 68 countries are still under 40%. So it's like more than a third of our member states still under that 40%, which means, and if you look inside that 40% number of the eligible population, what's striking then within that is the proportion of people with vulnerable underlying conditions or in older age groups who are still not vaccinated. This, to me, is the biggest tragedy right now, is that we're not protecting those who need to be protected. And then when they do get sick, they don't have access to the antivirals. So there's a double whammy in the process. So that's a little bit of a worry. I know I've given a long question to a long answer to a question on symptoms, but it triggers in me that idea that this hasn't gone away, and there are still too many people on this planet who don't have the protection of vaccination, who, when they develop those symptoms, for most of us now who are vaccinated, in developing those mild symptoms, that's what it stays, mild.
Was, some people just have a mild disease. I mean, this virus, the Omicron variant, in some countries caused more deaths than in previous waves. This virus, even the latest variant of concern, Omicron, and all of the sublineages, can cause anything from no symptoms to death. That's a huge range. So some people who may not have underlying conditions, who are vaccinated, may not experience severe disease. I was one of those individuals. I'm lucky enough to be vaccinated, but I still had quite a painful cough. But I'm vaccinated, and I'm healthy, and I'm, well, relatively young, I guess I could say.
You're younger than me.
I'm younger than Mike. But, I'm lucky because I'm vaccinated, and this notion that this virus has now become mild is false.
Yeah.
It's false, and we need to correct that narrative. This virus is killing people. It's killing at least 12,000 people per week, people who don't need to die. So I don't quite understand how we've become numb to these numbers, that is acceptable. It's not acceptable. It is not acceptable to the World Health Organization for any of our partners, which is why we are working so hard on this. So this narrative that this virus is mild or has somehow becoming more mild, the experience of getting infected with this is less severe for those who are vaccinated. But that is not the case for people who are not vaccinated. And that's why it is so critical we up these numbers of vaccination, turning vaccines into vaccination, and targeting those who are most at risk everywhere. Every single country, as Mike has just said, high income, low income, north, south, east, west, are missing vulnerable populations. And that's what really needs to be addressed.
Thank you, Maria. And Mike, you had the longer answer, but you did respond the question because we got a question about whether we reached the 70% target or not, but we haven't. And here is another interesting question coming from Monica Cardinale. Could you comment on the dropping of mask mandates on airplanes in Europe? And also recently I saw some comments on our social media posts that people were asking about our advice for traveling in the current context of the pandemic.
We've been doing quite a bit of traveling.
We have been doing quite a bit of traveling. And, you know, since the beginning of this, we talk about taking a risk-based approach. The risk is still there. This virus is circulating. What has changed over the course of a couple of years now is the addition of different interventions around the world, the use of these vaccines, the use of masks. And there are many different types of use of testing. We still continue to wear our masks. I can say I will still continue to wear a mask when I'm traveling, when I'm around the presence of others, even though I've had COVID and I've been vaccinated, because it just makes sense, you know, to use the tools that are provided. So don't have any specific comments on particular airlines or anything, but it's a risk-based approach. What we want to see are policies that keep people safe. And that's what we advocate for through all of our interactions with governments, with agencies, with travel industry, tourism, with businesses, with religious leaders. It's about using these tools effectively. You remember in the beginning of this pandemic, and I'm still struck by this, you know, about the discussion around masks and whether or not they work. We didn't have good evidence then. Hindsight, of course, it's much easier to look back now with the data that we have now, but masks are beneficial to prevent the onward spread. They also can protect you from infection as well. So we continue to advise the use of masks when you're around others, particularly when you're indoors, you're in enclosed spaces, because it's an added layer of protection, and especially among those who are vulnerable. It is really critical, and if you're not vaccinated. So please use the tools that exist to keep you and to keep others around you safe.
Mike, would you like to add something?
No, I noted on a recent flight we were on Dr. Tedros that he said, I think we're the only two people on this plane wearing masks. So, and I think Maria said it. She still has her hand gel. We still have our masks here. And yes, it can be seen as an inconvenience, and certainly there are many circumstances now in which if you're a vaccinated individual that your risks are relatively low, you don't have to wear a mask. But there are still situations in which, you know, certainly on a plane, for example, or on a bus, I would feel uncomfortable. Certainly I come to work every day on the number 8 bus. I wear my mask because, number one, if I was infected, I'm less likely to infect someone else, and I am less likely to be infected. And over a course of a week or a month, that just reduces my risk enough. It's not an absolute. It's just about that idea of a risk meter in your head. And you say, okay, over a week, I don't want to get infected. I don't want, not even though I'm vaccinated, I'm likely to have a mild course of disease or a milder course of disease, but I don't want to get post-COVID condition. This is something I can avoid, but at the same time, can't wrap ourselves up in biosuits, so we have to get back to normal life. So it's finding that balance of I still, when I go to a coffee shop now or I go out for dinner, I prefer to sit outside than sit inside. But if it's pouring rain, maybe I will sit inside. So it's about adjusting our behaviours as a society to try and keep the intensity of transmission down. And we've seen where, particularly Omicron has come, that infections can shoot up really, really quickly. And it's in those circumstances that having a return to just measures that keep that distance between us. So on the plane the other day, wear my mask. They were still handing out those little packets, those antiseptics, or the gels, wipe down the seat, wipe down the cover, takes 10 seconds, and put my mask on, and then I just feel, okay, that's fine, and I can still enjoy the journey. Others choose not to do that. I would hold nothing against them for that. I'm protecting myself, and others they operate within their own rights and what's allowed or not allowed. So it's not about looking down your nose at other people and feeling superior because you're doing something. It's about you as an individual, or you as a member of your family, making a decision for yourself and for those around you. And then we can get on. What I wouldn't like to see is people who continue to wear masks or continue to sanitize their hands being ridiculed by others. I've seen that happen, and that's not very nice. If someone chooses to protect themselves, I was in meetings in the United States a couple of weeks ago, and one person at the meeting continued to wear their mask through the meeting, but that person had a vulnerable individual at home. They weren't wearing the mask for themselves. They were wearing the mask because they didn't want to bring the virus home to a vulnerable person. So that was a good decision for that individual. So therefore, when you see people masking, you see people taking extra precautions, it's not that they've become obsessed with hygiene. Very often it's because they're doing that to protect someone else in their close family, or protect themselves because they're on chemotherapy or because they have an underlying condition. So if we have that tolerance where we allow some people in our society to take higher precautions, and support them in that, not just. And I've seen recently, I went to a shop, and the person in the shop said I was wearing a mask, and the person said, "Would you like me to wear a mask?" I thought it was very sweet and very professional. In other words, the customer service was, okay, this customer needs to wear a mask. Maybe that person has an underlying condition. I can offer to wear a mask, and I felt empowered by them. I said, no, it's okay. But I really felt that it's a small little thing, but I felt that that person was actually looking out for me and as a service provider in a shop. And I felt really good leaving that shop because I thought this organization cares about its customers and its clients, not about the rules per se, but about ensuring that they make everyone who comes feel comfortable. So I do think we have to enter that phase as a society where we're comfortable that some people won't be wearing the mask, but some others will. Some people will be more attentive to risk, others may not be quite. So I hope we have that approach over the months that come. But I would agree with Maria, I would still wear my mask on the bus, still wear my mask on a plane, because they're very enclosed environments in which you're very, very close to people for a prolonged period of time. And in that case, I can reduce that risk, so I choose to do that.
I had a few times situation in a corner shop in my neighborhood that I enter with a mask, and the guy working there tells me, "Oh, you can take it off," and I'm like, "I wear it because of I wear it for myself, so I'm fine." Here's a great question from Manuela Selly. Which one do you consider as the most challenging indirect impact of the COVID-19 pandemic?
I'll be here all night.
That's a very, Manuela,
question.
that's a really good question, and that's a really difficult one to answer. I mean, I think what we're seeing now, the world was so focused on COVID for so long. And as we said, we don't want to drop the ball on taking our eye off the ball on COVID. But I think with the recognition and realization, that we must not lose sight of all of these other challenges that we are facing. We have to find the right balance of dealing with COVID, but dealing with all of these other conflicts, all of these other crises that we face that didn't go away. If I think for COVID, one of the challenges that we are going to face, that we are starting to face, which I think needs much more recognition, is around post-COVID-19 condition or long COVID. In my trip to Brazil, I visited three post-COVID rehab centers. One was in a converted school, one was in a hospital, and one was in a community center. And to me, that was quite impactful to see the comprehensiveness in which post-COVID-19 condition needs to be managed. As WHO, we have been working on post-COVID-19 conditions since the first summer. We met with Dr. Tedros and I and others across our organization, including Janet Diaz, who's our clinical lead. We met with patient groups, and they asked us, they say, we need recognition, we need research, and we need rehab. For many, many months now, going on 2 years now, we've been focusing on making sure that there is identification of this with a case definition, making sure that we're having case report forms so that data can be collected and we can analyze this and understand what post-COVID condition is. We've been working across many different departments of WHO with many different types of physicians and clinicians, from pediatricians, dealing with adults and children across all of the different organ systems, and including mental health, the comprehensive nature in which people suffering from long COVID need to be cared for and cared with. And I think this is going to be a massive challenge going forward, because the sheer volume of cases that we have seen across the world, we've registered almost 515 million reported cases. That's 500 million reported cases to WHO. But the infection rate, the unrecognized cases, is well over billions. Billions of people have been infected with this virus. So we don't fully understand the long-term consequences. There's the acute infection, there's the acute disease, and people need to get through that and receive the appropriate clinical care, but we also need to provide longer-term care for those who need it. So this is something for us that concerns us, and we need to make sure that proper systems are in place within the healthcare system, so that patients receive the care. So one of the challenges I see going forward, and that COVID has additionally exposed, is this. And the increased risk for this, of course, are people who are vulnerable, people who don't have regular access to clinical care, people who were, the inequities that existed before this pandemic being exacerbated during this pandemic. So that's one of the big challenges I see related to COVID. And that is something that we're going to have to deal with for years to come.
Yeah, I think I would agree on the post-COVID condition, but also on that broader impact on the healthcare system. And I think COVID not only sort of exacerbated the problems we see in our system, but it really uncovered, it pulled away the veil from all of the issues of health inequity we have in the world. And systems were already weak, already unfair. They just became weaker and more unfair during COVID. Dr. Tedros is really focused on this right now and presenting a vision at the World Health Assembly in a couple of weeks' time, really about trying to refocus our efforts in health on health protection at community level, on the determinants of health, the things that determine your outcome when you get sick. So preventing hypertension and diabetes, managing it early, so we don't have to suffer the consequences when we have a pandemic of so many people dying because they have underlying conditions. Healthy aging and having care, better ways of caring for our older populations, and better ways of protecting them when there is an event. So there's so much we can do in protection of health. And then really refocusing our healthcare onto primary healthcare, onto free healthcare at the point of access, onto a situation where universal access to healthcare is a right, and people don't have to impoverish themselves and their families for generations because one person gets sick and requires sophisticated medical intervention. So there are all kinds of inequities in our system that have been amplified and highlighted, and a light has been shone upon this. And it's an opportunity for us to look at that and try and change the way we protect health, change the way we deliver health in terms of its fairness and its focus. And then a huge focus on having a more scalable capacity to respond to an emergency when it happens. We had a lot of rigidity in our system. Many systems failed to scale up. We couldn't move our resources around. Supply chains failed. So there's a lot of problems in our system in terms of its ability to be ready for an emergency. So if we think about that sort of health protection, healthcare access, and then health emergency response and readiness, those three things we really have to fix. And they're really, as I say, they were uncovered and exposed by COVID, but they were there beforehand. The other, I suppose, unseen or not unseen, everyone feels it now, are the longer-term economic consequences of COVID. I mean, there were economic downturns in the aftermath of COVID, but that's also been amplified now by other issues. If we think about in Europe, for example, Brexit generated all kinds of issues with supply chains and worries about the economy. Then we have COVID, now we have Ukraine. So we have different events occurring that are actually all converging and creating economic stress. Climate change and is causing economic stress in communities all over the world through drought and lack of water. So we're seeing economic stresses come from climate change, economic stress come from the pandemic, the economic stress coming now from war that's resulted in sanctions, where we have sanctions on countries, products and commodities are not flowing. We see the potential and long-term consequences now on the food security of the world with the crisis in Ukraine and our dependence on grain from Ukraine and the Russian Federation, particularly for feeding programs run by the World Food Programme. So it's very complex what's happening economically. Certainly COVID has contributed to that economic uncertainty, no question. Things that are driving that economic instability. We've seen inflation in food prices, particularly inflation in energy prices. And when you inflate prices of food and you inflate the cost of energy, it affects the poor the most, because that unit of food or that unit of energy is so much more expensive for someone on low income compared to someone on high income. So it has an immediate effect because it affects everybody. But that kind of, those kinds of economic pains really hurt poor people. Because if I have to pay an extra euro for a litre of fuel, for someone, a professional like myself living in Geneva, okay, I don't like that. But if I have to pay an extra euro for a litre of fuel when all I can afford is 1 litre of fuel and I have to feed a family, it's impossible. So a small change in the price of food or a small change in the price of fuel can impoverish people almost immediately. So we're really, really concerned about that as well. So COVID has driven that to an extent, but it's part of a much more complex web of intertwined economic threats that we're facing right now.
Question from Saran. Everyone around me, including the government, seems to behave as COVID is not around and has never been, and it makes me feel alone in this nightmare. From mental health point of view, can we have a closure? I think maybe we can address this question, and then Maria, it's not a time for closure, and I would like you to provide update with the variants, and that's something that we missed in this conversation as well.
I think Saren raises a really important question, in feeling alone. I mean, I think a lot of people in this pandemic have felt lonely, have felt quite alone, from either the physical separation from loved ones. There were a lot of people that were told to stay home, and our lives completely changed. We haven't seen our loved ones, we haven't traveled, for those of us who are fortunate to be able to travel, work has been disrupted, school has been disrupted. We think about this in terms of lives lost, but we also think about futures that, that have changed, that have been significantly altered, the trajectory of people's lives and livelihoods lost. So it has been quite a lonely time. I felt that myself, which is strange because we're with people all of the time, and we're doing these lives, and someone said to me, thank you for coming into my living room. You've been in my living room every day, which is just, it blows my mind that we're doing these things and we have that connection with people. So, we changed the social distancing to physical distancing because we want people to feel socially connected and find alternate ways to do that. But I do think, it also relates to the last question, the mental health of everyone, has suffered in this pandemic. I think we all want closure to the pandemic. And what we've been talking about in terms of closure is ending this emergency. This virus will be with us. This virus is going to circulate, but it doesn't have to be causing this level of death and devastation and disruption and impact that it's causing right now. That's what we're working towards. We're not working towards finding every single case and preventing every single transmission, and that's not possible anymore. Whether it was in the beginning is a good question, but we have tools right now that can keep people alive. So the closure of this trauma that we are feeling, and it is trauma, has to do with ending this emergency. So I think the closure is coming. I think what we were doing, I was having a conversation today with David Navarro, one of our COVID-19 envoys, and we talk every once in a while, and I think I was coming to this idea that we have to hold it together. Like, we have to hold this response together. We have to hold it together a little bit longer, whether that's related to our mental health or whether it's related to this notion that we can end this and the hope that we can do that. But it's tough. And so for Saren, who's out there watching, we just recognize that it's okay not to be okay, but there are also avenues in which you can get help. And I think everybody who's out there, again, myself included, we all need to reach out for help. And I think that there's some power in that. So closure is coming, but we're just not there yet. But don't despair with that. I think what we want to, when we speak, when Mike and I speak and we do this, we want to empower people with information. Not just the life-saving tools like vaccines, vaccinations, diagnostics, therapeutics. Information is power as well. Know what your risk is where you are. Lower your risk where you can, but live your life. And so do what you can to find joy every single day, whether it's reading or whether it's making a phone call or going out for a walk, whatever, listening to music, whatever that may be. That's still really, really important.
And I think COVID has been very isolating for many, many people. And as society has opened up, most people have rushed out, reconnected with everything in their lives, and it's been an exciting time. But for a significant number of people, that's been a very stressful time. Because I really feel for people who have found the opening has been a joy for most, but a challenge for many. And we do have to reach out and look around you, and look around your family, look around your friends. Find that person that's actually struggling with this opening up, struggling with reconnecting with people, because for many people that connection is hard, and that connection was taken away. And it doesn't, for many people, that's just, you can't snap your fingers and jump back into that. That's problematic. And people who suffer anxiety syndromes and many other things. So just important that you look around you and see who's finding it hard to be on that journey. I've certainly personally spent so many weeks and months alone without my family, and it takes its own toll. And friends at work and colleagues at work are fantastic, but you need your friends, you need your family, and it's just amazing. I'm very lucky. I'm really happy today. I've got my daughter sitting here with me, and I can't tell you the difference it makes. In my apartment last night, she's a Trekkie, I'm a Trekkie, sitting down watching some old Star Trek thing together. So just simply sharing a moment to eat some noodles and watch something silly on TV together, I've missed that so much. And they're the things that connect us. They're the things, and they're the things we've all lost. We've lost big things, but we've also lost many of the little things. And for many, many people, you look at some of the heroes, my heroes in this response are many of the seafarers who spent months at sea, never got home because of the vaccine restrictions and visa restrictions and COVID restrictions. So there are many, many people around, there were many groups who, for this pandemic, was very isolated. Many health workers who didn't go home for months. They slept in their offices sometimes because they didn't want to bring COVID home to their families. So this has had a big impact on us all, even though we mightn't recognize it. So it's really important that we're kind to each other, and it's really important we look out for those around us who may be struggling. And as you said, to say to people it's okay not to be okay, but also to encourage people to seek help where they need it. That's easy to say when you're, again, sitting in somewhere like Switzerland. That's not so easy to say when access to basic health care in many countries and basic psychological care is so tough and so difficult. So it's a very good question, and it's something we need to reflect on.
Thank you, Mike, and thank you, Maria. And maybe before we close, as you, Maria, said, we're working towards ending this emergency, but we're obviously not there yet. So Normie Camargo was asking, are we going to see a major outbreak all over again, like we did when it started? So maybe we can use opportunity while clarifying this to update on all those Omicron sublineages, BA.4, BA.5, BA.2.12.1. Did I say that right?
It was challenging me earlier, saying I look forward to you spelling that one out.
I was giving Mike a hard time. No, it's complicated. It's complicated. I mean, the virus is still evolving. I mean, let me address the latter part of her question first, because this idea that we will have another big outbreak like we did in the beginning, we're not in the same place as we were in the beginning. In the beginning of this pandemic, we had an entire global population that was susceptible to infection, meaning that anyone could get infected, anyone could experience severe disease. We're not in that same position that we were in the beginning of this pandemic. We have tools that save people's lives, that protect people from getting infected and save people's lives if they do get infected. The challenge is making sure that everyone everywhere has access to those tools, and that's what we're fighting for. So we're not in the same position where we will see that same level of devastation. What we want to ensure is that we have systems in place that can handle this virus. The virus is evolving, and we don't know exactly what characteristics the next variant will have. We know, one thing we do know is that it will be more transmissible because it has to outcompete, it has to replace other circulating variants. But we don't know if it will be more severe or less severe. But what we don't want are people out there to worry about that. What we need is to ensure that there's people around the world that have good surveillance systems in place, and that we are doing our jobs to be able to track and trace and assess this variant. One of the things that we're doing right now is we're looking at Omicron, which is the variant of concern, and all of the sublineages of Omicron, because this variant continues to evolve. The latest sublineages that we are tracking are BA4, BA.5, and another sublineage of BA.2, which is this BA.2.12.1. Don't worry if you don't remember all of those numbers out there. What we can say is globally, for Omicron, this variant of concern, BA.2 is dominant, by far dominant in all countries around the world. There is BA.4 and BA.5, very few sequences still to date of this. BA.4 has been detected in 16 countries, but a few hundred sequences, less than 700 sequences are available of BA.4 globally. And of BA.5, it's been detected in 17 countries, and only 318 sequences are available of that variant, so low levels. But what we're tracking is what are the characteristics of BA4 and BA.5. What we can say is that BA4, BA5, they're very similar because they have similar mutations in the spike protein and outside of it, so they're classified together, still part of Omicron, has a slight growth advantage over BA.2. And we are starting to see an increase in detection of these two sublineages in South Africa. We're really grateful to our partners in South Africa who are tracking this so carefully and sharing information with us and with the world in real time. Our technical advisory group for virus evolution is evaluating these sublineages as well. We see a growth advantage, but we're not seeing a change in severity compared to BA.2 or BA.1. And the reason I say that now is because we do see an increase in hospitalizations, but not at a rate that's different than what we had seen for the other variants. But we're tracking it. It's very early days, and we're looking at it. In addition to watching what's happening in people in terms of hospitalizations, we're also looking at what these variants do, these sublineages do in the lab with experimental studies. And those studies are underway. So we do see a growth advantage of BA.4, BA.5 over other variants of concern, but it's still low levels. And we're watching very closely what's happening in South Africa. We don't know how this variant will behave, these sublineages will behave in other countries that had a dominant wave of BA.2. And so this is what remains to be seen in terms of whether or not BA.4 and BA.5 will outcompete BA.2. The other sublineage that you mentioned, this BA.2.12.1, has been detected in 23 countries. But most of the sequences that are available, and right now there's over 9,000 sequences, most of those have come from the US. We don't have much information about this particular sublineage. We see an increased growth rate of this sublineage BA.2.12.1 over BA.2. So we will start to see increasing case detection of this particular sublineage. And we do have some data from New York, a state in the United States, not seeing a difference in hospitalization rates of this sublineage compared to BA.2. But again, this could change as more information becomes available. So what you need to know out there is that there are many, many people around the world that are tracking this extremely carefully. Our TAG VE, this technical advisory group, which is assessing virus evolution and all these mutations, we meet weekly. We talk regularly. Based on any of the information that we get. And if something changes, we also get the question a lot of why aren't you calling each of these sublineages another Greek letter? Right now, all of these sublineages are classified under Omicron, and all of these are considered variants of concern. If any of these sublineages have different characteristics, for example, if we start to see a change in severity, then we will likely give it another name. But right now, they're all classified as Omicron and variants of concern. So those of you out there, just, I hope you're a little bit reassured that there are many people that are looking at this. And we talk to governments all the time about the need to maintain the surveillance systems so that we can track this and we can trace it, we can assess it in real time.
Thank you so much, Marianne. Mike, please.
And what you said is absolutely the case. And in most of the scenarios that we've developed and looking at the futures we look at, we see the virus continue to evolve. We don't see the most likely scenario being that a brand new virus is going to emerge and put us back to zero. It could happen. It's like something that's there. It's a possibility, and that's why we need the surveillance to keep that early warning in place should it happen. But that most likely scenario right now is that continued evolution of the virus. But what we see, thankfully, is that the current vaccines, the current antivirals remain effective against all of those variants. So if you're someone in society, particularly if you're someone with an underlying condition or you're an older age group, what you need to be doing is you need to get smart about reducing your exposure. Maybe for people with underlying conditions, you need to get vaccinated and certainly have the primary course of vaccination and a booster dose if that's what's advised for you in your country. You need, if you get sick and you get that non-specific symptoms but you have an underlying condition, get tested early and get treated early, because these are the things that will save a life. And it's that sequence. Reduce your chance of being exposed, reduce the chance that an exposure will lead to infection, and that's vaccination. That's what vaccine does. Vaccines don't stop you being exposed to the virus. They stop you getting sick if you are exposed to the virus. Get tested if you're sick and get treated early. And if we do that in most situations, we will keep the hospitalization rates very low. We will keep death rates very low, even as the virus evolves. The problem we face is that that idea of getting vaccinated, that idea of getting tested, that idea of getting treated early is unfairly distributed around the world still. And coming back, you had mentioned the 70% target. WHO is pushing very hard with our partners to that 70% target and ensuring that 70% of the population have access, of the eligible population have access to that vaccine. There are countries now in which we are increasing the level of access that countries that have to the vaccine. But there are also many countries now, a number of countries right now, in which the demand for the vaccine has fallen, where the political commitment to vaccination has fallen, where we have significant problems in cold chain and supply chains. So we have to be able to deliver that vaccine to a population that want to be vaccinated. So reaching a situation where vaccine is available for 70% of the population, and then reaching a situation where 70% of the population is vaccinated, are two very different challenges. I believe we're coming very, very close to a point where we will have vaccine available to reach that target. And that's great. That's been a success. But we still have significant challenges as well in being able to deliver that vaccine. So we have to fund and we have to support countries in doing that. We have to generate the resources to be able to train the workers, to manage the supply chains, to provide the refrigeration, to generate the community engagement and education programs so that we can increase the demand for those vaccines. So we're not there yet on that. But in linking back to the risks associated with this, the long-term risks associated with COVID are manageable. Not like 2 years ago. They're very manageable. But delivering the vaccine, delivering the surveillance we need, delivering the treatments we need are the difference between us remaining in a very uncertain period with an unpredictable virus or having more certainty about the future. We can't control what the virus does per se, but what we can control is how we respond to the presence of the virus. And I think there's still a long way to go in many countries to support them in getting this job done.
For great questions today, as we had really a lot and we went longer than usual in terms of timing. So I thank you for your time, and Mike, this was a great advice at the end as well, how still to keep ourselves safe or what to do in case we get infected or sick. So thank you, and until next week, please stay safe.